and thank you so much for joining today's Aligned Modern Health Digital Doc presentation on healthy hair, skin, and nails from a functional medicine perspective. We really appreciate your time, and we hope you find the information interesting and beneficial. Before we get started, we'd just like to introduce Aligned Modern Health, just in case it's your first time joining one of our Digital Doc presentations. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider in the alternative medicine space. That just means medicine without the use of pharmaceuticals or surgery. At Aligned Modern Health, we really aim to get to the root cause of why you're feeling what you're feeling and not just focus on one siloed symptom or condition. We appreciate that each of our patients is a whole person and a unique individual, and we work to customize our treatment plans to suit the concerns, goals, and conditions of each of our patients. We have 18 clinic locations throughout the Chicagoland area, and some of our services are also supported via telemedicine. In each of our clinic locations, we offer chiropractic physical medicine, which is supported by chiropractic care, injury prevention and injury rehabilitation, athletic performance support, and clinical massage therapy. We also offer acupuncture, which is a practice that amazing benefits for physical pain, acute and chronic pain, but also some intangibles like stress, anxiety, depression, sleeplessness and insomnia, men's and women's health, and hormone balancing. We have a nationally recognized fertility and pregnancy support program. We support seasonal allergies, fibromyalgia, all different kinds of things that happen in the body that need support and attention. This practice also offers herbal medicine, cupping, and moxibustion. We round out our services with our functional medicine and clinical nutrition practice. This practice is also available via telemedicine in several US states. We like to say this practice takes a deep dive to better understand why you're feeling what you're feeling externally by looking internally. We focus on gastrointestinal issues, autoimmune disorders, bloating, constipation, fatigue, migraines, hormone balancing, men's and women's health, pregnancy support, food sensitivity diagnostics. And we also offer nutritional counseling as part of this practice. We are in network with most major insurance providers and are happy to offer a complimentary benefits check if you'd like to know what your insurance plan or policy covers. And we also offer free consults. Free consults are a great way to meet with a provider and ask questions specific to your concerns, conditions, or goals, and get some undivided attention from a provider to really get to the answers that you are looking for. Speaking of questions, we invite you to ask questions about today's topic on healthy hair, skin, and nails with Dr. Todd Roach. You are welcome to type your questions anytime into the Q&A feature of Zoom. That's the little icon with two conversation bubbles that says Q&A. Dr. Roach and I will address questions at the end of the presentation. At this time, it is my pleasure to introduce Dr. Todd Roach from our functional medicine team.
Good afternoon, everybody. Thanks for joining us. Again, my name is Dr. Todd Roach. I am a functional medicine provider here at Aligned Modern Health. And one of the big questions I get asked a lot, and sometimes it's a chief issue that we need to talk about. Sometimes it is a kind of a side complaint or side symptoms are connected to skin, to hair, and to nails. And so we're going to talk about that today. We're going to talk about some of the different aspects of it and what it means, and certainly kind of figure out what's going on with your individual concerns with it. But one of the big things that we want to talk about is the term health and what it really means to be healthy. Healthy skin, healthy nails, healthy hair. And one of the biggest things that comes from the idea of health is not never having any symptoms. It's not that everything is perfect all of the time. The big thing with health is the body being able to adapt to the stressors, whether it be virus, bacteria, emotional stress, workouts, too little, too much. We're going to talk about all of those stressors a little bit later on, but that's really what health is all about, is how is the body responding to it? How is the body able to handle the different stressors that it comes across on a daily basis? And so I'm going to talk about skin first and foremost. And one of the biggest things with skin that we need to remember is that as large of an organ as it actually is, one of its main main jobs is protection. Second main job is to get rid of trash, to help us drain out the waste products of the body. Now, the liver's involved with that, the kidneys are involved with that, the sinuses are involved with that, but also the skin plays a huge role. And especially if there's any liver, kidney issues starting to happen there, the skin main job to get rid of that trash becomes the number one part of it. So that's something that we want to pay attention to and take that into account when we are dealing with skin conditions. Now, sometimes there are things like contact dermatitis, some of those allergic responses, but a lot of times the skin is a great reflection of what's going on underneath the surface. And one of the big things that we see in practice is the immune system and involvement of the immune system. So we have parts of the immune system. One of them is to fight off all these foreign things, but the other part is to promote healing. And one of the big parts of that is to get that trash out. And so a lot of times skin is one of those first places where we'll have these kind of check engine lights coming on, and there'll be things like eczema or like hives or weird rashes that come and go, or even warts to a certain extent. All these skin changes, these things that we see coming and going, are usually a representative of something that's happening underneath the surface. And I see a lot of times how that can progress, especially, I'll be honest, especially in little kids, how they start with eczema and then it becomes hives and then allergies and asthma and on until a lot of times we're dealing with autoimmune conditions. And so that's one of the things where I always cringe a little bit when I hear somebody say, oh, it's just my eczema, or it's just hives, just a small amount of hives, because this is a big deal. These are big check engine lights coming on, telling us that there's something going on with the immune system, and we need to figure out what it is. And again, a lot of times it's that immune system not balanced and not able to handle whatever is the trigger that's causing the stressor. The other aspect of skin, it shows us a lot of what's going on from a hormonal perspective. And this is where we oftentimes get into the different types of acne. Is it cystic acne? Is it on the face, the jawline? Is it around the menstrual cycle, on the back? Wherever it is, a lot of times that is a great symptom of something going on underneath the surface from a hormone perspective, whether it be estrogens, testosterone, progesterone, or even insulin and cortisol. I mean, we have a lot of hormones that can be imbalanced, and the reflection of that imbalance coming on at the level of the skin. And of course, we can certainly go to any high school in the country and see where there's some hormonal imbalances, and certainly see skin displaying those hormonal imbalances. And then another aspect of this is hair growth. Hair thinning versus hair growing in all the wrong places. A lot of times a condition this is commonly connected with is something like PCOS, or polycystic ovarian syndrome. And again, that's underlying blood sugar and estrogen levels tied to that too. So hormone imbalances play a huge role in, again, the healthy skin, the skin being able to handle these triggers. And one of the big parts with this is that skin also represents the health and vitality of the body. Water, vitamins, minerals, those are the big three things that we want to make sure the body has. That's the premium gas in the tank, allowing our body to do what it needs to do. And certainly water intake is always one that I preach about a lot. But vitamins and minerals play a huge role with this too. We're going to talk about that in a little bit more detail, but that certainly is a big part of the skin's overall ability to adapt to different triggers. Now, hair and nails, those two usually show us what is going on from do we have enough of the nutrients and minerals? This is where it's stored a lot of the time. So we can see this with nails, for example. A lot of times that we have cracked nails, very thin nails. Sometimes we see ridges in the nails. Sometimes we can see white clouds underneath the nails in the nail beds. And that will tend to tell us how we're doing with zinc. So in some cases, we can see the way the nail fills. We can see that from a blood vessel cardiovascular aspect. So there's a lot of things that hair and nails tell us when we're looking at mineral deficiencies, or even diving into vitamin deficiencies, especially vitamin B, biotin, niacin. Those types of vitamins play a huge role in the health and well-being of the hair and nails. So I do want to talk a little bit about some of the common treatments that we start to see with hair, nails, and skin. And one of the big things is a lot of times we're looking at the nutritional blankets. There's lots, I'm not going to name any names, but there are a lot of vitamins that are designed specifically for hair and designed specifically for nails. And I think, those are great if that's what is needed. We have a lot of times where we can have some deficiencies, and these types of big general lots and lots of vitamins and taking that consistently will start to fill some of those gaps. One of the biggest things, and I'll take the moment to kind of talk about right now, when it comes to vitamins, minerals, and water, one of my biggest pet peeves, and it's probably more me personally a big pet peeve, is that there is this, oh, you should be having 200 milligrams of whatever it is, or 500 milligrams of whatever it is. The problem with that is there's no individuality with that. There's no, when it comes to vitamins and minerals and water, there's the supply to meet the demand of the body, the individual lifestyle. Certainly different amounts of vitamins are different based on a person's age, their lifestyle, their exercise level, their overall eating habits. Like you can see, if you eat fast food all the time and you have a very, very stressful lifestyle, the demand for vitamins and minerals and water is going to be completely different than somebody else who's doing really well. And that's something that I always get kind of frustrated with, because I will oftentimes have patients say, well, hey, I'm taking, this one multivitamin that's supposed to do everything. Well, it depends on what the actual needs are of the body. So a lot of times when it comes to these traditional approaches, it's very kind of hit or miss on, is it going to fill the gaps, and is it going to provide the health that the body needs? Sometimes it does, sometimes it doesn't. Unfortunately, most of the time it doesn't, and then we lead with lots of frustration with that. The other thing that's very common is something along the lines of intermittent fasting, and we're seeing this a lot, especially social media, and it should be 1 day, 2 day, based on your age and all those things. I've seen those graphs over time. Not everybody can handle intermittent fasting. Intermittent fasting was designed originally to truly help people that had insulin resistance. And even at that point, and I've gone to the seminars, I've read the books, even at that point, it was based on an individual basis. Like each amount of time for intermittent fasting was determined by that person's current lifestyle, their blood work, their overall health, their eating habits, their family life, their work stressors, all of those things to determine the length of time of intermittent fasting. But now, of course, it's become almost a contest to see who can intermittent fast the most. And there are health benefits to intermittent fasting for sure, absolutely. The biggest part of that is it helps the cells get rid of the trash. It helps the cells get the trash to the curb, get picked up by the body and get filtered out. But if we have a hard time in that process, then intermittent fasting isn't going to do anything. It's going to cause more harm than good in a lot of cases. And so again, we just have to pay attention to that and find out, what does the body need, because there's no real blanket, this fix everything type of approach. And then various diets. And of course, diets always, low FODMAP, anti-inflammatory, candida, all these different diets. Every time somebody has talked about a diet, there has always been this, that there's going to be an end at some point. It's like, oh, I'm on this diet for the next 4 weeks, 6 weeks, 2 months, whatever it is, and then I get to go back to what I want to eat. And I always cringe at that, because if you were already not doing very well from a food perspective, and all of a sudden we have all these symptoms, well, then taking some time off of that will give you some short-term results possibly, but then we're going to be right back to where we started at some point. So those huge, broad, this is the latest and greatest diet, as great as it is for us to click on social media, not necessarily fit for every single person. And then, especially with the skin, but also with hair and nails, we have the creams, the oils, and the ointments. And a lot of times what starts to happen with this is, these are vitamins and minerals, very similar to the supplements that we saw. These are vitamins and minerals that are absorbed through the skin into the blood supply, and maybe they fill some gaps, maybe they don't. Another one with this too are oftentimes steroid creams. And steroid creams are great in some cases, in some situations where all heck is breaking loose. Absolutely, let's do that. Let's take the battery out of the smoke detector sort of thing. But at the end of the day, we still have a problem. We still have a problem underneath the surface that's causing the rash, that's causing the hives, that's causing the flare up on the skin. That needs to be addressed, not just using it to kind of cover it up, turn off the beeping noise while we still have smoke in the house. That is where we run into problems for the long term. So, of course, these are all things that we want to pay attention to because it might not be exactly what the body needs to remove some of these symptoms. So what we want to get down to is really identifying what the root causes are. And this is different for every single person, and even from a genetic perspective. Just because something worked for your sister, for your brother, for your mom, doesn't necessarily mean it'll work for you. And that's something that we will oftentimes address in quite a bit of detail when it comes to our approach from a functional medicine. It really is identifying what does your body need at this point and what do we need to do to get it in there. And we'll talk about that certainly in more detail. But I want to spend some time talking about the stressors that I was talking about earlier. And we have 4 different types of stressors. We have emotional, physical, chemical, and environmental. Environmental stressors, these are molds. A lot of times, for example, aspergillus, this mold is common in water damaged drywall, water damaged homes, but also in certain foods that are like nuts, raisins, dehydrated berries. It's very common, like trail mix types of things. Aspergillus can be causing some problems from a mycotoxin standpoint. We can have metal exposure, heavy metal exposures. This is a great one because oftentimes heavy metals, if the body is not doing well, it's going to hold on to everything, whether it's good or bad. Heavy metals, very common to see heavy metals in a lot of patients. Even when it comes to even kids nowadays, I see more and more heavy metals found in kids. Bacteria, obviously bacteria overgrowth at the level of the gut, but then we also have that microbiome that's in our sinuses. We have lots of places where we have the good bacteria. And of course, any sort of imbalance there is going to trigger an immune response. Yeast, other types of like candida, and candida albicans is a big one that we see as a small part of our microbiome, but can oftentimes get overgrown in the area and again cause that immune response that we see at the level of the skin. And then of course we have viruses and parasites, which are oftentimes something that we need to pay attention to, again in the gut quite often, but other places of the body too. And again, that immune response is something we want to pay attention to. Now this is one of my favorites because we're talking about physical stressors. Physical stressors, a lot of times we start to think about the aspect, and sometimes I get to have this conversation dealing with working out, and we get to say this. And I remember a long time ago, I had a patient who she told me that her primary care doctor told her she should start working out. And I said, "Oh, that's great. What'd you start doing?" She goes, "I don't know. I have no idea what that meant. No idea what working out meant." And I thought to myself, that's a good question. That working out is huge. Is it huge? Do I read a book on a treadmill for 45 minutes at the same elevation, same speed? Or does that mean joining CrossFit? Or does that mean doing jumping jacks in the basement? Like, what does that working out actually mean? And that's something we have to figure out. Because sometimes if we do have this immune activation and we do have this a large amount of inflammation in the body, then working out like we're 30 years younger, that's not going to help us at all. It's actually going to cause more harm than good. It's going to be a physical stressor on the body that the body cannot handle. And unfortunately, I've had this happen more and more because there was that marketing idea in the past of like, well, no pain, no gain. And unfortunately, some people take that to heart and think, oh, I have to just destroy myself every day. And the problem is if the body is not able to heal itself, if the body's not able to rebuild itself, if it's lacking proteins, fatty acids, carbohydrates, vitamins, minerals, water, then the body's not going to be able to heal. And again, we think we need to keep destroying it over and over again, but we never get to rebuild it. And that just becomes more and more of a stressor on the body. And then, of course, working out too little, that is very common. And that is, again, we have to find out what we need to do to create the movement that not only your body needs, but also fits into your day-to-day. The body loves movement. We need to have movement on us every single day, basis, either a light active recovery or a very strenuous workout. We need to have that type of stuff happening every single day. We just need to figure out where in the body we need to be with that. Do we need to be tearing it down? Do we need to be more focused on recovery? What is it that the body needs at an individual level? Because the cookie cutter, it just doesn't work for anybody. And then let's talk about the chemical stressors. This is always a fun one because we get to talk about the hormones, and of course, estrogen, testosterone, insulin, handling our blood sugar, cortisol, handling our stressors, and then thyroid. Thyroid's a big one. Those 5 hormones are huge. There's lots of other ones, but those 5 hormones are huge. When it comes to, they need to be balanced, and we need to pay attention to that, because if there's an imbalance in these hormones, they're going to act as a stressor in the body. And then all of a sudden we can have rashes, eczema, we can have thin hair, losing hair, we can have cracked nails, thin nails, all of those things because the demand is so high. Inflammation, we talked about that, the physical stress, certainly chemical stressors tied to inflammation. Are there all the great chemicals that are involved when we have inflammation, and then we start gaining more fluid, and all of those great things start to happen with that? Alcohol and sugar. In fact, sugar, one of the biggest sources of gasoline on the fire. A little bit of inflammation, you eat sugar, that's going to times 1,000. It's going to make that huge, and it's going to make it that much bigger of a chemical stressor on the body. And again, we need the building blocks in order for the body to handle those stressors. And then food allergies and food sensitivities, those are always a fun one, because that really does tell us, is the immune system really ticked off? As you can imagine, as the demand on the immune system gets higher and higher, the more, and I'll use more irritated the immune system gets, and the more sensitive it gets. And food sensitivities, food allergies are, hey, I touch something, I can't breathe, my tongue swells up, I get a rash, whatever it is. But food sensitivities, these are things that can last. We can have effects from this from 2 days. So 2 days. So you could have stomach pain or regurgitation or diarrhea, today, and it's because you had something to eat 2 days ago that caused the problem. And so those are always things we want to pay attention to. Also, is really identifying, are we continuing, to throw rocks at the bee's nest the whole time? That with the foods that we eat, that's where we start to run into troubles. And then the last one here, the emotional stressors, and that's really paying attention to, how are we handling our work life? How are we handling our home life? How are we handling, certainly, family? Just all aspects of it. Are you allowing time for yourself? This is a big part of really being able to control all of that, and have your ability to handle and adapt to those stressors, to handle those stressors differently, to handle the end of day conversation with your spouse or with your kids a little bit different than maybe yesterday when you flew off the handle type of thing. And so when we're talking about these stressors, I always kind of use this metaphor of a laundry basket. Some days a stressor is just like a sock. Some days a stressor is like a t-shirt. Some days, eating a donut and whatever for breakfast is just a t-shirt. Some days it is a down comforter, right? And if we start to overflow, we start to load up too high on that toxic load, if we start to overfill that laundry basket, that's when the immune system gets involved. That's when the body gets involved. And of course, all of the stressors kind of fall into that same bucket. So you can imagine if you had, you woke up late and a car didn't start, like all of these emotional you didn't eat well, now these chemical stressor, you didn't get your stretch in or your workout in, now we didn't work out for the day. Like all of those things start to add up over time, and that will absolutely trigger a overall kind of a response by the body, and it may not be able to overcome that one well. So that's what we want to pay attention to. And I get told this a lot, and I love this. This is a hard one. I get it. Everybody does it. The only thing that changed, and I love that, we refuse to acknowledge that even the stressors that we know of, the physical, chemical, emotional, environmental stressors we know of, there are still stressors that we don't know about, the stressors that we're not technically thinking about. The person that coughed on us, in the elevator or something along those lines, we're not even really paying attention to that. We think the only thing that's changed is I woke up 10 minutes late, or I had I had 2 cups of coffee versus 1. Why is my body doing this? But very similar to what we were talking about with the food sensitivity testing, it can be days. It can be days of things piling up. And then all of a sudden, that second cup of coffee puts you into multiple bowel movements or whatever the heck it was. So those are things that it's really hard. We all do it. We all try to figure it out. But the problem is that there are so many variables, so many moving parts to it, that it does make it really, really hard to identify that one thing. And in fact, even with the wheels of the clock, it also is happening inside the body, that certain deficiencies are not going to spin the wheel fast enough, and that's going to slow down the healing process, and all of that kind of works in that same kind of manner. So let's talk about what we do from a functional medicine approach. And there's a couple things here that are important. And I hope the biggest part of that is it is the individual approach that we want to pay attention to more than anything. And that starts, there's kind of 4 parts to that. The first part is really finding out where you are, finding out what is going on, what you've been through over the years, what's been going on, different triggers along the way, that we can start to identify certain things you've handled well, things that you haven't handled well, and really finding out what's going on. And of course, this is, and this, the most important word on here is, it's a conversation. It is really finding out your story, because it's different than every single other patient we've ever seen in our lives. And that's the important part. Again, we're not trying to squeeze a round peg into a square hole. It really is finding out what your story is. And most importantly, what your finish line is. Why are you here? What is it you want from this? And what does the finish line look like? Because then we move into, well, where is our starting? And by that, we start to look at objective measurements. I need facts, right? I need facts concerning blood work. I need facts maybe concerning other testing, like your hormones, testing like your gut, the microbiome in your gut. Are we looking at food allergies, food sensitivities, those types of things? We need to have actual facts for that. And of course, when it comes to blood work, one of the big things that kind of sets functional medicine apart is that we look at, if any of you have ever had blood work performed, you've seen the ranges, right? The parentheses, the ranges. And so, for example, like I'll use like thyroid stimulating hormone as an example, TSH. That range is, I think the standard range is 0.5 to 4.4, 4.5. It's ginormous. And what we do from a functional medicine perspective is, like, yes, we do want to see when the wheels are falling off, but we also want to bring that in a little bit and look at optimal values and see, well, is the wheel shaking, right? Is the wheel starting to shake a little bit? Because we might be able to do some things from a preventative standpoint to prevent that wheel from falling off later on. And so we always look at that when it comes to blood work, when it comes to other sort of tests that we do, is not only doom and gloom, but also how is the overall optimal functioning of what this test measures. And so that's always a big deal. And we use that to put together, here's our starting line, here's our finish line. Now let's put together a plan of action. And of course, this involves nutrients, nutrition, big deal with that. We also look at lifestyle habits. Again, think about those physical stressors, chemical stressors, environmental stressors, and emotional stressors. Sometimes the hole is a little deep, so we need to use supplements to help get back to an even keel there, that we can start using more lifestyle. But we also want to set the expectations. What is it that you expect from this? What are we going to expect along the way? What sort of side effects, or a lot of times with supplement, what kind of effects? What does it do? We don't have a lot of side effects. We're really looking at what do we need to do as we put the right kind of things in the body. And then, of course, my biggest part of this too is I want to give you tools in your toolbox for the rest of your life. I always tell patients, I'd love to see you 20 years from now. I just don't want you to be in the same pit you're in now. I'd love for us just to be talking. I really try to aim that have patients having tools in their toolbox that they know what to do. Again, back to that diet term that we talked about before. No, we want to use a food plan. I want you to eat this way the rest of your life and allow flexibility for holiday parties, weddings, and everything else in the world that you want to do. We're just going to do it a lot smarter and pay attention to what our body actually wants and needs. So this is kind of the approach that we do from a functional medicine perspective, finding out what's going on in your story, finding our starting line, finding our plan of action to get from starting line to finish line, and then certainly arming you with tools in the toolbox to move forward. But I think the biggest thing is that the skin, hair, and nails are very big dashboards that can oftentimes have a lot of underlying problems that, if they're not identified, will continue just kind of patching and putting a piece of tape over the light, so to speak. So guys, I want to thank you so much for your time, for joining me. Hopefully there was some information there, and I'd like to open it up if we have any questions at all.
Thank you so much, Dr. Roach. That was fantastic. Yes, we do have some questions, and we encourage you at this time to please continue typing your questions into the Q&A feature on Zoom. Again, as a reminder, that is the icon with the two little conversation bubbles so that Dr. Roach can take your questions. While you are typing in those questions, we just wanted to reiterate again that we do offer free consults. So if there is a question you have that's specific to you that you might not want to ask in front of a group or on a webinar, you are very welcome to request a free 15-minute consultation by calling 773-692-6700, or you can visit us online at alignedmodernhealth.com. As you can see, we are in network with most major insurance providers, and we are happy to investigate your coverage if you'd like us to. And again, we encourage you to type all questions into the Q&A feature on Zoom. Dr. Roach, a couple of questions coming in here. You talked a lot about vitamins and minerals and nutrient deficiencies and things, and how important it is not to throw a nutritional blanket at a problem, and how things need to be hyper customized and individualized so that they're really working for the patient. Are there any vitamins or minerals in specific that you suggest testing for deficiencies if somebody's nails are weak?
Yeah. So a lot of times the B is in boy vitamins, so B1, B2, B6, B12, B9, a lot of those vitamins play a huge role in hair and nails. Also vitamin E, vitamin A, vitamin C, and of course vitamin D. So I don't know if vitamin K, I'll just name them all, but I didn't mean to do it like that. But B vitamins are probably the most important, because a lot of times, and I'm gonna tiptoe around the rabbit hole of methylation and that aspect, that a lot of times we need certain B vitamins in certain forms for them to be able to do their job. And so a lot of times when I see nails and even hair to a certain extent, it really comes down to, is there an underlying kind of a genetic disposition like MTHFR, like those things like that, where we need to have more methylated forms of some of those B vitamins, because that's the overall deficiency. And so that's what I tend to look at. And I do, on blood work, I certainly test B12 and B9, vitamin D all the time. Those are the big three I see deficient in most people. But sometimes we do have to take a little bit of a deeper dive into some of those other B vitamins. And then, of course, keep in mind that methylation aspect for sure.
Thank you so much. We have a question here about testing, which we touched on briefly. And this question is specific to testing for inflammation, for mold exposure, like the mycotox test, for hormone testing, for Dutch testing. Are these the kinds of tests that folks can find by seeing a provider at Align Modern Health?
Yes, so we do a lot of Dutch testing. There's different aspects of the Dutch test. A Dutch Complete, one of my favorites, and I've been using that one for years. Microbiome testing, I think food sensitivity testing, we do a lot of those tests. I can't remember the other test that was in the question, but yeah, we do all of those tests. And what was the other one? Food sensitivity.
Mold for
mold testing. Oh yeah, we use there are different types. There's a couple different companies we use for the mycotox testing, and yeah, that's a simple urine test in most cases. But yeah, no, we use a lot of those tests at the line for sure.
Great, thank you so much. We have a couple of questions here that are asking kind of in general about what folks can find from their primary care physician or folks that they're already seeing, or a requirement to see specialty care like a functional medicine physician at Align Modern Health. And I'll actually be happy to address this. I think what Dr. Roach said about allowable versus optimal and doing a much more comprehensive deep dive into the diagnostic work is the answer there, right? So a lot of these questions you can speak with a primary care physician or folks that you're already seeing. But if you are having symptoms or conditions or things that you're not getting the answers to from the physicians you're seeking, a specialist is totally appropriate to help do a little bit of a more comprehensive, deeper dive into why you're feeling what you're feeling. Is that fair, Dr. Roach?
Yeah, I'm going to piggyback that because a lot of times clinically, I hear a lot of patients say, well, this is what's going on from a symptom standpoint. I feel very good, all those things, but I just got my blood work done and they said everything was fine. And I think there's a gap. There's a huge gap between, blood work being fine and having lots of symptoms, and then all of a sudden the symptoms are so bad that now the blood work has followed suit. And so that area of time, which can sometimes be years, unfortunately for some patients, is really our wheelhouse of saying, no, this is where the function is. We're not just waiting and sitting on our hands for the disease to present itself. We're really looking at overall function and identifying what can we do to improve that function overall by kind of establishing these priorities and putting a treatment plan in place.
Perfect. Thank you so much. Another question here about kind of a progression of symptoms. So somebody that had eczema that maybe turned into acne and then found out they had food allergies, possibly being related. And then the question also is that correctable? And or how would you treat when it's kind of a progression where symptoms have changed over time from being a kid into potentially being an adult?
Yeah. All right. No. So this is good. And usually I have to draw this out, so I won't draw it out. But so what happens a lot of the times is that we have kind of two parts to our immune system. The one part very reactive, creating a lot of antibodies, very over the top active for viruses, bacteria, and all those things. But then we have the other part that calms that first part down, but also promotes a lot of the rebuilding of tissue. And that second part requires a lot of vitamins and minerals and fatty acids and amino acids. And so what I see, and of course I'm being very general with this, is that when I see kids that kind of have some of these immune imbalanced conditions, right? And I start to see that if we're not getting those good things in there, then I'll start to see that progress. But of course, the older we get, the more we need the fatty acids, and the more we need large amounts of those. And so a lot of times it's more of a nutritional deficiency in most cases, I'll be honest, most cases that I see. And that's something where that becomes our focus. What do we need to do to get that nutrients in to start balancing out the immune system to prevent maybe such a huge long list of food sensitivities and reduce a lot of the symptoms of that immune activation? What do we need to do to get more of a balance, not suppressing and calming down, but more of a balance?
Thank you so much.
Is that helpful?
Yeah, absolutely. We talked about, hair obviously as an indicator of underlying conditions and things. What do you generally suggest? And we know there's no universal answer here, so we're not trying to put you on the spot. But what do you generally suggest to look at first when a patient comes in dealing with long-term female pattern hair loss?
Oh, yeah. Okay. So two big things that I pay attention to a lot with that is certainly the thyroid and estrogens. And looking at things like we brought up the Dutch test, probably one of my favorites when it comes to that, because a lot of times that estrogen metabolite, right, the waste products of estrogen, and when I say estrogen, I mean all three of them, is if we're not balancing that out, if we're not getting rid of that well, then we are going to have a lot of those the hair loss. We're going to have a lot of those types of symptoms tied to that. So thyroid and estrogen levels are always number one, number two. And then number three, a little bit farther down the list, number three would be more of underlying inflammatory trigger, like perhaps maybe like a yeast overgrowth or bacteria, good bacteria undergrowth, bad bacteria overgrowth, or in some cases even parasites to a certain, somewhere there's a trigger to the immune system. But that's usually number three on my list. I really look at thyroid and estrogen levels. And then of course that, we do have some signs or symptoms we can tell from that if estrogen levels are out of whack, but a lot of times I do look at those waste products of estrogen and testosterone and progesterone.
Thank you so much. That was a great answer.
Sure.
Another question here from a guest that has struggled with rosacea over the course of his life, and his dermatologist has stated that it's purely genetic. The only thing he can do is a prescription cream or ointment. What are your thoughts on that? And are there any alternate theories or common root causes that you might speak to, or is that
Yeah.
kind of fair what he's learned from his derm?
Yeah, so rosacea is one of my biggest things. So, all right, so rosacea, I always get fired up about rosacea because I feel like it is one, and there's a couple, rosacea being one of them, that is very dismissed a lot. And it is one of those things. One of the biggest problems with rosacea is that it is kind of a sign telling us, hey, the immune system, something's going on with the immune system. And a lot of times I've had patients, both male and female, where the rosacea has kind of continued on, and then all of a sudden, oh my gosh, I didn't know I had lupus, right? Because the rosacea is very commonly connected to the autoimmune disease of lupus. And so anytime I see that, I always get fired up about it, because I will have patients that will just say, oh yeah, I have rosacea and this is what it is, and go on forever. And that's one that I was talking about earlier, where it feels like we're just sitting on our hands until all heck breaks loose and we have the positive blood work for lupus. So I tend to get a little fired up about that, and I look for what's going on with the immune system. I use rosacea as one of those big smacks in the face of something's going on with the immune system. What do we need to do to get that balanced out? Because I'm not one that just wants to sit around and do nothing and let's just kind of wait and see what happens. I don't think I've ever said that over 30 years, but I'm very much hey, especially if that's a big thing that's been going on for a long period of time, we gotta find out what's going on with the immune system and then start helping it do its job versus taking over and all those other things, especially because a lot of times they use steroid creams for that, and that drives me crazy. So sorry, I got a little emotional on that one.
That's okay. Getting fired up shows your passion for what you do and your commitment to helping your patients. So I hope that
That's
was beneficial and interesting information for everybody. That does bring us to time. We are over time today for today's webinar. However, there are a few questions still out there that are totally valid, and we see them, and we absolutely invite you to schedule that free consult to get your questions answered. Again, you can give our team a call to schedule that consult at 773-692-6700. Just mention you have questions that you'd like answered in a free consult after participating in the Digital Doc webinar, or of course, you can visit us online at alignmodernhealth.com. Dr. Roach, thank you so much for joining us today. And to all of our guests, thank you for your time. We hope that you found this information beneficial. Our next Digital Doc webinar is on Thursday, May 23rd at noon Central. You can register online at alignmodernhealth.com. And the topic is workstation ergonomics and workday stretches with physical medicine physician, Dr. Caitlin Painshad. Again, thank you so much, and we hope you have a great day. Cheers.